Our health is not just about how well we feel physically. Our health is about how we feel emotionally.
We're finding it's becoming vital, and it's really important to recognise that when you're dealing with an individual, there's lots of aspects to that person. And if you really want to impact on their health, you have to look at what's really going on behind the scenes.
Social prescribing is transformational because it allows people the time to think about what is important for them and what matters to them.
So the evidence is that about 25% of visits to primary care are primarily social in origin. But of course, we've been trained in a very medical model, and therefore we tend to try and medicalise things even when they perhaps shouldn't be medicalised.
And the difference between us and GPs is we have a bit more time to talk to them, and we're really finding out about what's going on with them as a whole.
Because if somebody comes to you and says that they're not sleeping very well, there's a reason. In 10 minutes you can't get to the bottom of that reason why they're not sleeping, but in an hour I can.
So it's a real way of listening to people, hearing them, and reconnecting them with services.
Social prescribing is really placing communities at the heart of public health, and so that's what we want to encourage.
I really believe that GP practices shouldn't be sort of standalone services within a community, and really should try and be a beacon of good health within their communities. And one of the really important ways to do that is to connect with local services.
We're linking with the community groups and the voluntary organisations by networking furiously.
For social prescribing to work successfully, you need to have a strong partnership with primary care, with the local authorities, the voluntary and community sector, but most importantly with the residents and the patients.
So we're referring to a lot of our organisations who do a lot of befriending, benefits advice, employment advice, mental health advice. Again, is an increase in terms of anxiety, depression, isolation.
So it's working together that allows us to have a successful social prescribing network and system.
There's so much help out there. That's where we can make a difference, is we can do this linking part. That I think is really important. That's where we make a difference.
During COVID, social prescribing's played a really key role. They've been incredibly flexible. They've responded to the pandemic, doing welfare calls for very vulnerable people, putting them in connection with key services.
In fact, for all of us really, COVID's had a profound effect on the amount of social contact that we get. And that's particularly true for people who are most vulnerable, because they're often medically very vulnerable as well.
We've changed the way that we provided our service, overnight. We went from being a mixture of telephone and face-to-face to being just telephone.
We've actually done some fantastic work behind the scene, and I've actually tackled quite a few cases where perhaps even on the face-to-face the people may not have come through. So it's also proved its positive aspects to social prescribing.
The pandemic was an opportunity for us to demonstrate what we could do.
And I think they have a really pivotal role in preventive medicine moving forward, for sure.
If you're thinking about the individual, your patient, it's really important to think of them as a whole individual. And if you really want them to improve in their health, you have to think about the rest of their well-being, because for them a lot of times other needs are their focus, and if you can help resolve those problems, you'll improve their health overall.